spending bill that passed last night aims to cut $2 trillion.
Right.
Can you guarantee that Medicare, Medicaid, Social Security will not be touched?
Yeah, I mean, I have said it so many times, you shouldn't be asking me that question. Now, we are going to look for fraud. I'm sure you're okay with that, like people that shouldn't be on, people that are illegal aliens and others, criminals in many cases. And that's with Social Security. We have a lot of people.
Behind the scenes, he gave his approval to a House budget reconciliation package that proposes to cut $1.7 trillion in net spending, with the lion's share of that looking like it's going to come out of Medicaid. Republicans want spending cuts to somewhat offset the whopping $4.5 trillion in net tax cuts they want, which will still result in a $2.8 trillion increase in the primary deficits over 10 years. So much for Republicans caring so deeply about cutting the deficit. We need to get rid of all programs that help people because deficit. But tax cuts for the rich over everything. The top 10% of incomes will receive 56% of this monstrous tax cut value. Literally trillions of dollars. Literally more than Medicaid times 2. While just 29% of the tax cut value will be distributed to the first 80% of the income distribution. From dead broke to the guy who has more income than 79% of all Americans get a measly 29% of the loot. The big dogs who are already rich AF gonna eat all that Medicaid money as a pre-workout meal, then chow down on some education, agriculture, oversight, transportation, financial services, and natural resources grub for their post-workout meal. It's of utmost importance to shut down all kinds of services and give that money to the already filthy rich. Despite the tax cuts and the projected economic growth that the tax cuts will supposedly create, which is only projected and quite dubious at best, that trickle-down economics flow at a time when the nation has been getting wrecked every which way. Lower-income households will be significantly worse off if the spending cuts are in Medicaid and Supplemental Nutrition Assistance Program, aka SNAP. More money for the top 10% of incomes to stash in the Cayman Islands, or healthcare and food for the poorest people. Good thing we're a government of the people, by the people, for the people. I mean, a government of the rich, by the rich, for the rich. Although the final spending cuts have not been specifically defined, it is expected that of the approximately $880 billion in cuts by the Energy and Commerce Committee, almost all of it will probably come from Medicaid. Medicaid is funded by the federal government and individual state governments to provide health coverage to children, pregnant women, the elderly, people with disabilities, and low-income individuals and families. Over 72 million Americans are enrolled in Medicaid, which is around 21% of the population. Over 7 million children are enrolled in the Children's Health Insurance Program, aka CHIP, which is designed for children from families with incomes too high to qualify for Medicaid but too low to reasonably afford private insurance. Republicans in Congress have long salivated over the possibility of cutting Medicaid. In Trump's first term, he made a huge push to try to undo the ACA known as Obamacare, which in part expanded Medicaid to cover low-income individuals and families. Republicans always justified decreasing Medicaid spending because of general fraud, waste, and abuse accusations. But they have no problem continually pouring money into defense spending when the Department of Defense can't ever get a clean audit. Help people bad. Buy more gun good. Don't know where gun money going, but gun money good. What Republicans don't mention about Medicaid is that big Medicaid cuts will not only eliminate health coverage from a significant portion of the American population, it will lead to the closure of hospitals, clinics, and other health facilities used by people who aren't on Medicaid, especially in rural areas. Medicaid cuts will deeply, severely affect red states that love Trump. When Medicaid patients become uninsured patients and end up seeking treatment in emergency rooms, which is usually the only choice a sick or injured person without insurance has, and they've sometimes waited for an easily treatable problem to persist into a life-altering problem before they go to the emergency room, it will cause hospitals and clinics with emergency services to raise rates for people with private health health insurance to offset costs, not to mention emergency rooms will be very overcrowded. People with private health insurance will face higher premiums and worse experiences in emergency rooms. Substantial cuts to Medicaid will affect pretty much everyone. And let's not forget, when you are cutting assistance to that many people, that many millions of people for something as vital as healthcare and food assistance, you are probably going to increase the rate of crime significantly. It is literally going to be a hellscape in every way you can imagine. Considering how many of the working poor rely on Medicaid for health insurance because their employers don't offer health coverage, millions of people who can't afford to buy private health insurance will have no access to medical treatment. Congressional Republicans have talked about work requirements for Medicaid, which raises its own set of administrative issues resulting in people losing coverage or never getting coverage because of reporting process issues due to administrative errors and compliance errors related to stringent documentation and reporting requirements. So we could effectively see many people who are working end up not being covered by Medicaid or intermittently losing their coverage. This doesn't even take into account all of the people with health issues or other issues preventing them from meeting work requirements who can't qualify as disabled under Social Security definitions, which are quite strict, which will prevent them from being able to get any healthcare coverage. The main point is that millions and millions of Americans will lose their healthcare. This will result in people with treatable conditions turning into people with serious health problems. This will effectively be a death sentence for many people in what is supposed to be this superpower country, greatest example of all that is good, advanced civilization. Yeah, right. We need to be increasing coverage, not decreasing coverage. The Commonwealth Fund, a foundation dedicated to the improvement of healthcare, which has been around since 1918, published a report in 2024 evaluating the health system performance of 10 Western countries. They found that although differences in overall performance between most countries are relatively small, the only clear outlier is the U.S., where health system performance is dramatically lower. They based their findings on data collected through surveying older adults, primary care physicians, and the general population in participating countries. They also based their findings on data from the World Health Organization, the Organization for Economic Cooperation and Development, Our World in Data, national data registries, and other research literature. As you can see, the U.S. is way behind the other countries that were evaluated. As you can also see, the U.S. spends way more on healthcare for a substantially worse performing healthcare system because it's the only country out of the bunch that does not have some form of universal healthcare coverage. So less people are covered, and private insurance companies, pharmaceutical companies, and medical facilities are constantly jacking up their prices to increase profits. The only area where the U.S. scored high on was care process, which looks at what most experts around the world would consider high quality care. The high care process ranking was due to U.S. preventative services like mammograms, flu vaccinations, and patient safety. It is believed that Medicare, the federal health care program just for the elderly, and other payer policies that reward the delivery of preventative care contributed to the high ranking in this area, as well as America's focus on patient safety in hospitals compared to other countries. Medicaid also allows for preventative care, which ultimately saves lives and lowers costs. If you want more information on their data collection, analysis, and other details, you can find their report on their website. America's healthcare system is already considered very bad while being way more expensive than other developed nations. And by decimating Medicaid, it will only make a bad situation worse. Medicaid expansion under the ACA inched the U.S. closer to everyone getting healthcare coverage. America needs more healthcare coverage, not less. Many studies and forecasts have been done showing how much less America would spend in the aggregate if some form of a single-payer healthcare system was implemented. America needs some form of universal healthcare, and there are many ways of enacting it and many examples of how such a thing is being successfully implemented in other countries. If America were to choose to adopt a system like what they have in Australia, where they have universal health care as well as private insurance, the universal health care system helps regulate overall health care costs, which ends up making their private health insurance significantly cheaper than American private health insurance. It effectively makes all the costs overall decrease. Health insurance companies are not providing valuable services. They are essentially money-printing businesses that act as middlemen, aid in jacking up prices, and are set up just to profit, not to provide as many services as possible at the best price. They set the prices and premiums such that they provide as little as possible for the maximum price. Big Pharma charges people more for prescription drugs in the U.S. than it does anywhere else. This is because the American system allows them to do that. Our corrupt politicians allow this corrupt and disgusting healthcare system continue. The American healthcare system in its current form is an absolute scam and an abomination. Consider how bad the American healthcare system is at present. Now imagine things getting more expensive and more people dying from preventable diseases or developing lifelong impairments that could have been fixed with surgery or medication, and even more people being saddled with astronomical medical debt that will never get paid and will only serve to destroy people's lives. Chopping up Medicaid without any strategy of implementing a better system that actually works for all Americans is one of the worst things the government could possibly do at this time, but they don't care. Why? Because they are proposing to deliver trillions of dollars to the wealthiest people who want to hoard even more wealth that they'll never spend at the expense of American lives. The same way they don't care about sacrificing American lives for unnecessary wars. The rich want more and more and more. They don't care about the consequences. Even if they know they'll lose tons of seats in Congress, they would have accomplished their ultimate mission, capturing more wealth for the American oligarchs who are never satisfied in their constant struggle to siphon more and more wealth from those who have less. Trump once commented on how America has the best doctors, the best treatments, the best facilities, and even people from Canada and the UK are flying over to America to get treatment because they can't manage to be seen by competent doctors in their failing public healthcare systems. You think someone who can afford to fly to America, stay in America, and has the ability to see the best doctors, even getting those appointments with the best doctors in the best facilities, or hell, even a mid-doctor at an aight facility, and pay out of pocket for a surgery was ever at the mercy of any public healthcare system? America has some fantastic physicians, medical treatments, facilities, etc. And you know who reaps the benefit of having that first and foremost? The rich. Trump and the rich people around him wouldn't have a clue about dealing with a health insurance agent on the phone, telling them that their coverage is denied or refusing to cover some obscene hospital charges, or telling them about all the hoops they have to jump through to get an MRI, or why they can't see a specialist. He couldn't give a rat's ass how much a medication costs, an ambulance ride costs, an ER visit costs, or an extensive surgery with a world-renowned surgeon costs, because that kind of money is irrelevant to someone as well off as Trump and most of the people who are making these decisions to cut Medicaid and to maintain this horrible healthcare system, if you could even call it a healthcare system in America. I mean, the politics business is the best business that Trump ever got into. He gets to facilitate giving himself tax cuts and all of his buddies, which makes it more worthwhile for Elon and the rest to give him hundreds of millions of dollars. And Trump wants to talk about shithole countries. Every country becomes a shithole country when you have to choose between getting your car fixed or your tooth fixed. Just kidding. In America, that's a no-brainer. You gotta get your car fixed first because you have to get to work. All your teeth are mostly good for is eating, and with food prices these days, you ain't doing much of that. Trump probably spends more on getting those hair-looking strands sewn into his scalp every month than most Americans make in a year. Trump's monthly McDonald's bill is a mortgage payment for an average American. One of Trump's golden toilets is greater than the average American net worth. When Trump came to California to talk to people whose houses burned down, he couldn't even fathom not having the cash on hand to rebuild a house immediately. Because, of course, everyone has the cash to just rebuild their house. That's why every day he's adding another 10% in tariffs to China, Canada, and Mexico. Price of random stuff is totally irrelevant to him, especially when you consider the $1 trillion of tax cuts for the rich. They're trying to sell the tax cuts as something that will help the economy, when all it will do is make rich people richer and poor people poorer, and without health care. Poor Republican voters think that voting against DEI and a woke agenda is more important than their own lives. That's the ultimate dedication.